walk one, walk down. It's proper mechanics, body mechanics. You're lifting up, lifting down. All right. These are small, minor exercises, right? Actually, there's another one. You guys ever do this? Right? This actually helps you work out your calves a lot. Even right now, some of you are sitting down. You can go this way. Yeah, because you feel the tension pulling in the front part, right? If you go this way, you feel it in the back. So these are slight minor exercises where you can do while sitting down. It's not strenuous. It's more of a range of motion. And I would suggest doing it 2 to 3 times a day, 10 times each time. Right? And you're taking deep breaths. Here's a funny exercises that I always teach people. Your glutes, squeeze them. Like that, squeeze them. So when you're squeezing them tight, it actually works your back, neck, and your muscles, right? It's especially those who have knees and hip surgeries. Has anyone ever had one yet? No? Yeah? We teach them that when we squeeze our glutes, we're actually trying to loosen up and tighten up our muscles each time. Because when you have these procedures done, your muscles are too tight, too stiff. You're just trying to break it out so that you can actually keep using it on a day-to-day basis. So what we call is iso mechanics, iso exercises, just like ripping it, you know, like these are iso. You're isolating the certain body part for exercises. It's not hard. You're just utilizing your own brain and your body, each part. Make sense?
Okay.
I was going to say balance is really important, and you know, he was talking about those exercises you do, like tipping your toes when you're standing up. Those are really good exercises to see how you balance, right? Is it easy to do? You need to hang on to something and try that. And some of the exercises for balance are very important as well, because that's going to keep you straight. That's going to keep you walking correctly, because you've got good balance. You're not going to be kind of swaying or wobbling. And I noticed that all of you don't have a walker. Nobody has a walker here, right? Or a cane. So that's or way in the back.
At home.
At home, you have a walker
Okay.
or a cane. Okay.
Think of any of our joints. We're always just doing day-to-day activity. We're not moving my arm. But think of it as you want to move it, right? Different parts. You don't have to carry weights if you want to. You can, but you're just using range of motion. Sometimes when we're doing our legs, hold onto the table, swing forward, just loosening up that hip muscle, right? Who gets that achiness in your lower back and your right? Sometimes you just kind of sway it forward or sway it to the side. Just want to loosen it up a little bit, or to the back.
Is it okay to do to the side if your hip is raised?
I would limit it.
Yeah.
Know your body the most. Know where is your breaking point. Like, let's say if you can know this is as much as you can do.
Okay.
It's slight exercises. I bet you in a week, after you do it 2 to 3 times a day, you'll be able to expand it a little bit more.
Okay.
Yeah, I helped a patient with multiple sclerosis, meaning the spine is also curved, scoliosis as well too. He was curving. He was able to walk, hike. What's the one in Fremont? The Mission Peaks.
Yeah.
Yeah, he was
like
able to do
12
Mission
miles.
Peaks on a day-to-day when he was younger. But unfortunately, because of his prognosis, things changed. He started having a little bit of shakiness, not able to get up anymore, and he kept on falling almost 4 or 5 times a week. It was really scary for him, right? He had a walker. He wasn't able to think about doing it again. But home health, we trained him. We started teaching him to grab onto his walker, push up. That's it, just range of motion. 30, 40 times a day. After 1 week, he was able to do it himself without assistance. Without assistance. Another week, we started to talk to him about having assistants to just guide him and walk him. He kept on dragging his feet because his mind was scared. He was always afraid to just lift up his feet. we're like, hey, don't worry, we got you. We took a belt, put it around him, and assisted with him walking each day. I was like, lift up your legs. He started to lift it up. By the third week, he started to walk about 15 to 30 feet on his own by just guiding him with a walker. The fourth week, he walked 50 to 100 feet outside. We took him for one time outside, walked around the driveway. He was like, I haven't been outside for about 6 months. Right? So that's how body mechanic works. It's more about using your mind to really slowly take its pace and improve your range of motion. So it's not to say it might be a little bit challenging, but baby steps. It's not hard. Take your time, do a little bit of motion each day, and you'll get there.
How about standing on one leg?
It's good for balance.
I would not suggest that unless you're going to be holding something. Like if you're going to be holding the table right here, use your dominant leg to stay grounded and lift your other leg.
Just, yeah, I have Parkinson's, and that's one of the.
Parkinson's. So let's practice maybe something I can help you with. So let's see if you're walking wise. You walk a lot, right? 2 to 4 miles a day. So sometimes, let's put your hand on this side, right? Use this leg, and you can. I was watching you when you were walking. Oh, let's put this one down. When you were walking, you were just walking straight, really soft, not using your knees as much. Let's try to lift this leg up more. Yep. And right.
Okay,
Yeah.
thank you.
And then you can switch sides, use the other one, and over time, when you're walking as well, I'm gonna raise my leg higher. I'm gonna raise my leg higher. So you're just gonna keep reminding yourself on a day-to-day. I'm going to walk a little bit higher. I'm going to walk a little bit higher.
Like you're stepping over a puddle.
And that helps with balance,
Yeah.
because you're doing something straight, and you're doing something in a small steps, baby steps.
I go to Kaiser Hospital every month for the occupational therapy, and I learn a lot of exercises. The one is you're showing me,
Yeah.
then the other showing.
Yep. To the side.
Absolutely.
Oh.
Wow, look at that.
That's more aggressive.
This has been, he's been doing that therapy for a long time. That's great.
So he's going to an outpatient
Right,
therapy,
therapy.
right? That's where your
Excellent.
community resource is able to help teach you these types of exercises where they have
The
materials.
physical therapists can also teach you.
Absolutely, yes, yes.
PT and OT.
Right, right.
Yeah. It's not strenuous, but they teach you these types of techniques so that it's safer for you. It's not as strenuous, so you're gonna increase your chances of falls.
Right. They leave you with exercises so that you can do it on a daily basis. And when they come back, or when you go back to outpatient, you're able to perform and say, this is what I did and this is where I am now. So from there, they can continue the path to getting to where you should be, which is, you know, your plateau, your goal.
Walking backwards?
I would not do that. remember what we talked about vision, right? You always walk
Kasabay niya yung
forward.
isa eh.
You walk backwards, I'm not going to see where I'm already
Kasabay
stumbling
po yung
myself.
isa.
So,
One leg.
Kasabay yung isa.
That's great.
those are
May
perfect water
pasaway
aerobics.
po dito sa class na to eh.
You go back, maybe a step.
Maybe if you're swimming with backstroke, so that's okay. But
May mga pasaway, may mga pasaway po dito mga puti.
Swim upside down backwards.
you can if you just take your slow steps back in the pool, right?
And,
Because
you know,
water
go with
will
the
still give
back
you
and forth.
resistance.
You know, the whole group
Oh,
goes
the whole,
together.
right, right.
Make sure there's no one.
There's no one
Yeah,
behind you.
just be aware of your surroundings. That's what I would suggest. Questions? I really like how everyone's engaging and actually sharing their experiences about it.
And what I was gonna say as well is that, you know, if you come back from the doctor and there is a certain diagnosis that he's saying, oh, you may have Parkinson's, or
Sa
you
hindi
might
pa po
be starting,
nakapag-subscribe,
you know,
please
some
subscribe
other
my
type of
channel, hit
skeletal
the notification
problem,
bell para
maybe then you
ma-update po
should
kayo sa
consider
aking mga
and ask your
bagong
doctor, what can I
upload.
do Or should I
Thank
have
you.
some therapy if
Please
I'm out and about? Get
subscribe,
some
share,
outpatient
like,
therapy.
and share.
And if you're
Thank
not
you.
able to get out because
Shout
it's,
out
you know,
in
you're
lahat.
not feeling well,
Thank
you're
you.
sick, you've had a cold or you have a flu,
Thank you.
that's another thing you can say, hey, maybe I could get some home health. And as things get to the point where you feel like you're getting better because you're having the therapy, of course, then they'll say, hey, maybe you should go to outpatient therapy from the therapy in the home. So there are a lot of options that you can use and you can think about, but your doctor would be one that would help you with that.
Range of motions, right? Your hands, keep them moving. Your legs, you know,
Circle your
circle
ankles.
your ankles.
Oh, I do that on the plane.
Oh
You
yeah.
do,
see?
yeah.
Things like these will definitely prevent you from arthritis or joint tightness. Okay.
Circulation is so important as well. So you wanna make sure that there's enough blood going to your foot where you come in with the range of motion as well. Making sure that, you know, you're getting good circulation down to your foot and it's coming back to your heart.
The reason why your heart is still pumping blood, right? If you're sitting down too long, blood is just gonna sit at the bottom of your foot, your feet. It's gravity, it's pulling downwards. You wanna keep moving, pumping, so it's pumping the blood back into your system.
So it all correlates together, right? I mean, if you're sitting, as he said, and it's pulling down to your feet, what happens? You might start getting swelling in your feet, right? Because it's dependent. It's hanging down. So oftentimes the doctor will say, lift it up a little bit when you're in bed to get that circulation back, right? That's one of the things that you can kind of think about. So it's very important that you kind of don't leave everything dependent and you get some care for whatever it is if you start having swelling in your feet too. Let the doc know about that.
Sometimes when you wake up in the morning, leg exercises, you're just laying down, lift up a little bit, right? These little small minor techniques. You're watching TV, you're trying to just circulate your legs a little bit so it's moving. So just lift it up.
Sometimes our feet gets numb
Yes.
after sleeping for a long time, like 8 or 9 hours. When they get up, your feet,
Yeah.
gets numb, and they have to sit down for 15 seconds. And sleep.
That's a perfect example. It's numb. Your blood is not really circulating around. It's just sitting at your feet, and it's not circulating with the new blood all around.
How about walking sticks? Are they,
Those are great.
Those are wonderful.
My yoga teacher suggests us, before you stand up from chair, you do 2-3 times moving and like a bouncing, then you stand up. Then you have a more chance to not to fall down.
That's good. That's good.
Correct. Going back with the walking sticks, it's wonderful. It keeps you balanced. It's using less pressure on your legs and your body, so you're using it to leverage each time. But make sure you're walking properly with it, right? One side, whatever side you want. Just feel dominant about it.
That's good.
You can just use one if you want, one more.
You can.
Some do, yeah, some do, yeah, I've seen some. Yeah, going back to her, you know, I think when the yoga teacher is telling you to do this, it's a good thing because that's making you sit and wait before you stand up. So it gives you some time to get the blood flowing, so when you stand up, you're not feeling dizzy and you're not lightheaded as well.
Do you have exercises for the plantar fasciitis that you refer to?
For me, it's usually just trying to isolate. Like in my mind, my wife had it so bad. I just told her to isolate it, just kind of like range of motion, twist the ankle, circulate the blood a little bit more. Kind of over time, it just became, it kind of disappeared. Yeah.
I think also the shoes are very important, because my
Yeah.
sister has plantar fasciitis, and there are certain shoes, she'll try on shoes, she goes, no, this is not right. Or, you know, it's for comfort, and it's also to support the bottom of your feet.
Yeah.
And that's so important, because you're on it, your whole weight is on your feet
Yeah.
when you're up walking.
So you can always just lift it up. I don't know if anyone can see. I'm just lifting it up this way, right? Just kind of stretching it out. Simplest exercises. Hold on to something, be safe, and just kind of like push down on it each time. You're welcome.
Any other questions?
What causes leg cramps?
Ooh.
not enough water. Drink enough water.
What causes
What's the question?
Leg cramps or cramps in general, right?
Cramps in general.
Cramps happen because you're not hydrated. Your muscles are not receiving enough oxygen and water throughout its system. So the anatomy is saying, okay, if it's shocking this region specifically, it's not getting enough water. It happens all the time.
But I usually get that in the morning when I've been sleeping, and I can feel that the legs are cramping when I'm in bed, as I get up.
That's because you've slept for so long without drinking water at the same time. When you drink enough hydration water,
So the muscles get tight.
yeah, it gets tight.
So we need to drink before we
And
go
so-
to bed?
I know.
Be careful for that too.
I found that in the morning before I get up and I'm laying in bed, is on a bicycle and just for.
Oh.
Yep, riding like a bicycle.
And then they talk about cramps in the
Oh, yeah.
calf area.
the calf area.
So it's, yeah, it's toes to your nose, right? Bring it up,
Yeah,
because
bring
that's
it
gonna
up.
help the cramping.
Muscles, yeah.
And the muscles right in your calf area.
Careful not to, right, people think like, oh, I'm just gonna massage it, right? Be careful. Massaging is sometimes what can break into blood clots, right? Yeah, people are not aware of that. Massaging because you're
This
just
the
trying to push
teaching
the
us,
blood
okay,
to
so
make it flow. You're supposed
ito
to
parang
technically
education po to sa mga
stretch,
matanda.
like stretch. When you
Educational
see
po.
athletes, they're supposed to stretch. What I'm doing right now is this is my foot. I'm kind of pushing it against this way, so I'm stretching my calf.
Oh, when you have a cramp.
Yeah, you're supposed to stretch it. Right?
And it's painful.
Who can I demonstrate on? Someone wanna? Yeah. Right. People who play basketball, volleyball, sports in the past, right? You're stretching it this way, pushing it. So you're supposed to tighten it, which is correct, until it loosens it up and goes away.
Like putting pressure.
Yes.
And just remember, toes to your nose, so it's always coming out towards your nose.
Yeah.
Yeah, that's how you help.
If
relieve
she's
some of
standing
that
up,
pressure.
then all she is doing is just pushing pressure. Yeah.
Oh.
Right? Proper techniques. These are the lunges that she's doing. When you're doing lunges, you're sort of just tightening that part.
Yeah.
Drinking water at night, it is very dangerous because you're gonna go to the bathroom more frequently. I try not to say don't drink after 8. Just drink more during the day, but nothing after 8.
You have you hear all different things about how many glasses of water you should drink a day. How many?
8, yeah, people always say 8 glasses of water.
Yeah.
But what if you weigh 100
what the
pounds and
doctor
someone
says.
else weighs 200
Yeah,
pounds?
yeah, ask your doctor what.
Eight. Correct.
Yeah.
Limitation, right? Some people have a fluid restriction. What we call is 1,000 liters a day, right? That's a limit restriction because if you have heart failure, you have to limit it. You cannot take enough water. Water is just gonna keep sitting in your lungs, your legs, right? Someone said lungs, you heard about that before. It happens very often. So ask your doctor, consult with them. What is my limit, right? Because when you're taking your blood work, they can check your heart, check your values, how much electrolytes and vitamins you're supposed to be taking on a day-to-day basis. That's why it's very important to get your blood drawn every 6 months.
How do they tell about electrolytes and vitamins? Do they have to specifically test for vitamins?
Electrolytes,
Electrolytes,
yes, they
yeah.
do. Yes,
Or
for
Albumin levels. So when you
Sodium,
get your
potassium.
blood work done, it says cholesterol,
That's-
right?
that's
All
the
that, all those
right.
numbers.
Yeah.
Those will tell you what your electrolytes, what your vitamins that you needed, your protein, your calcium, your glucose. Those are all important numbers that's operating in your body.
And for electrolytes, it's the sodium and potassium, and that's gonna be showing in your
Yes.
blood work. So they can see if you are balanced, or you need to bring up a little bit of the potassium because your potassium is low, things like that. That's all in your blood work, so we can only stress too is get to your doctor, get a physical and labs. Labs are very important. They show
They
values.
show value.
Doesn't One A Day Centrum kind of supply all that you need?
Centrum would be a good one. I mean, there's a lot out there. Costco has so much different brands, 1-A-days, vitamins. So,
Right.
but I would say suggest consult your doctor.
I take Centrum for the elderly. You know,
Yeah, they do
For
have.
men.
For men.
How about using arthritis ointments for leg cramps? Would that help?
Yes, there's
Just rub
Voltron,
it,
Arnica gel, because it relieves pain.
like
Like-
hydrocortisone?
That's more for itchiness.
What was the question? I'm sorry.
He was saying cream for arthritis.
Ointment.
So there are creams for joint pains, right? Lidocaine patches, Salampas, things like that. Those are options. But Arnica gel, Voltron, they are all over the counter. So you can walk into the store, CVS, Walgreens, ask them what type of gel can I apply for arthritis, joint pain. Yeah, you can definitely apply a
And just-
little bit. Okay, not don't
And
put a
just
whole
let your
block.
doctor know what you're doing and making sure that's clear, because there are some things that may be contraindicating, meaning
Spasms.
it's not quite connecting because you're taking other medications or other kinds of ointments or,
My friend suggested me to take protein powder to drink to make me healthier. Is that good to do it?
It is. It's good for weight. Like if a lot of people are losing weight, it has a lot of L-theanine, creatinine, like a lot of other substance in there that can help you out. So those are vitamin drinks and kind of whey protein drinks because it's milk-based powder in a sense. Question. Yeah,
any other
everyone's really
questions?
engaged
Great
about it.
question.
Is it all right to lose weight?
She wanna lose
Be
weight.
careful how much you're losing in a sense.
I weigh myself, but my husband says he watches me eat and he gains the weight.
My mom is the same way. She's like 100 pounds, right? But her cholesterol level is over 200 something. I was like, how is that possible? Yeah, it's very possible because she's eating like meats, fatty foods, fatty acids, but she looks so thin, so very thin. And the doctor was like, why do you have 257 for your high cholesterol level? She's like, I just eat a lot of food. But she walks around on a day-to-day basis, right? See, what happened to her, she's like, I have to watch out for my cholesterol. It's really too high. I'm worried because cholesterol can cause strokes, right? That happens. Increase her chances of falls. So she just drank a lot of water. On a day-to-day basis, drank water, lemon and water in the mornings, cleared up. It dropped down to 130 points afterwards.
And she ate the same things?
Yeah, she ate the same thing, but just drank water. Ate
Lemon
a little bit
water.
more fiber,
Fiber.
vegetables.
That's a little
Green,
bit more balanced
dark
diet.
green leafy
Right.
vegetables. They have the most nutrients versus the light nutrients.
Absolutely. Yeah, very.
Fish.
More
Fish has really great
More of the white
veggies,
instead of the
chickens,
red meat.
white meat.
White meat, yeah.
Red meat has a lot of iron, but it can also be dangerous. in a sense.
But you do need a little bit of iron.
Yes, definitely. And that's another thing that can be
Iron.
tested when you get your labs done.
Yep.
The basic, you'll get an iron level to see if you are low, anemic, or if you're on track, or if you're having too much iron too. Yeah.
These drinks, I heard someone, I can't remember the name, but it's fermented. It's a fermented drink.
The kombucha?
The kombuchas?
Kombucha?
Kombucha, yeah. that's it,
Kombucha?
yeah.
That-
Is that, what is that and how does it help?
I never really looked into kombucha. I know we had it a lot at the store before too, but it is fermented.
So you get drunk also?
Yeah.
It's supposed to help your
It's like a low
autoimmune,
percentage of
right.
alcohol.
It's
What does
supposed
it
to be-
do? What does it do?
It's like a probiotic,
Yeah,
so that it
probiotics.
will help
Oh, yeah.
the
Excrete.
digestion.
Probiotics are good in the gut.
Exactly.
Probiotics are good.
Right.
I heard is drinking a tablespoon or teaspoon of vinegar or balsamic, is that good?
Some vinegar.
Apple cider vinegar.
Apple cider vinegar, yeah.
Yes, I've been doing
But it's really not that tasty.
it.
Yeah, it's
A little glass of water.
What
It's-
about a teaspoon of olive oil?
I would
That's
say
a good fat.
I've
That's a
heard of
good
it too,
fat.
but I never tried it. I wouldn't say I would do it. I mean, that's just me.
But better than vinegar.
Yeah.
Well, there's bad fats and
greasy,
good,
yeah.
there's bad fats and good fats, and avocados is good fat.
Right.
Yeah, honestly, water. That's just how I see it as, and sleep Sleep and water. Like Cherry was saying, oh, you're losing weight. I was like, I don't think I'm losing weight. He's like, what am I doing? I haven't exercised. I just drank water. Because water, you're just excreting a lot of the toxins out. Your kidneys are functioning very differently, right? It's trying to excrete a lot of the urine, the bowel movements. People have constipation because there's not enough water in the system. When you drink enough water, it clears everything up. Sorry, I'm getting into like the nitty-gritty.
Does it have to be water or just liquids?
Preferably water, because tea, coffee, it's caffeine. Caffeine will increase your heart rate, but it also causes you to, what do you call it? Dehydrate your body.
It's a diuretic.
It's a diuretic. It dehydrates your body. Yeah, sodas, caffeines, like it dehydrates your body.
And it doesn't help you sleep.
Herbal teas are
How
okay.
about decaffeinated coffee? Is it still a diuretic?
It's still a diuretic.
Really?
Yeah.
Yes, 'cause it's coffee.
It's still
I
caffeine.
love
It's
it
just
so
less
much.
amount of caffeine.
I just-
But you realize when you drink coffee or a decaf, you have to go bathroom later on, right?
Yeah, but at least there's water, a high percentage of water.
It is a diuretic, so it just urinates it out. You wanna read the good water.
Yeah.
Herbal tea.
Herbal teas are good.
Oh my
Yeah,
goodness,
they're not caffeinated.
how did we get to
I
nutrition
know.
from fall prevention?
Well, you know, we've been talking a lot about the
Because
home
when you're
health
on
part.
kombucha, you're drunk and you fall down.
That's what we do, like making sure that you're gonna get treated at home, and if your doctor wants you to get therapy at home or get a nurse in, whatever it is for your condition. We also provide also the hospice, which is kind of like, they have different norms about what hospice is, and it's very different from what we used to think way back, because when I had my father-in-law, you know, he didn't have hospice, and I thought, oh, never, you know, we'll just take care of him at home. But it's come around, and this was already like, oh, let's see, before 2000. The social worker just told me, talk to the oncologist, but there was never ever hospice mentioned. So it always has kind of like this negative thing about
It's a
it.
stigma. People don't wanna talk about it, but we all know we are gonna go at some point, right?
Yeah.
And how many people here have worked in their lives?
Worked?
Worked ever, have a paycheck.
I've been lady for
You
80
see the
years.
pay stub that says Medicare, you're paying for the benefits.
Yeah.
So don't think of it as, oh my gosh, I'm gonna die or anything crazy like that. Think of it as, you know what? I've been paying this all my life. I'm gonna get people to help me out. So that's it.
How long does it take about for someone to come to your house, like say you break your leg? I mean, can you get somebody like the next day? Or do you have to
It
wait
all
a week?
depends on, well,
When you're a doctor and your insurance.
We're fast.
Yeah, we're fast, but you know, would depend on, we check eligibility, get your doctor's order in order for somebody to come to your home.
Do you work with Kaiser?
We do.
yes,
And you guys take Medicare?
Yes.
yes,
Oh.
yes.
So what Cherry is saying is exactly the correct, you know, we've paid into Medicare, I'm Medicare, and I paid into it.
Sorry, but I have to
gotta
step
run.
out.
Okay,
I'm-
yeah.
I'm gonna see patients.
How many
Thank you.
thought this was helpful?
Yes, thank you.
Okay, we went from fall prevention to everything.
Thank you guys.
If you could write down,
Thank you, thank you, thank you so
we'll be
much.
back, but if you could write
Finish
down,
mine here.
you know, the topics that you'd be interested in.
Were we supposed to sign in?
Yeah, there's a sign-in sheet over
So,
there.
dito na po. May tapos na. Thank you so much sa for watching. Shout out sa inyo lahat. Ito po, educational po sa mga senior. Kasi ito, between dito na to sa mga, yung iba nito mga 80. Mga 80 years old na po. Mga attend na umattend
Are you
dito.
guys
Thank you.
connected with the Kaiser?
Yes.
We are connected.
They are, but,
Kaiser.
any living, it's private pay. It's not covered by insurance. It's all private pay. Yeah.
So what do you cover? What is your
So,
aspect?
so I'm senior living, so I'm assisted living, and I'm independent living. So families will come in, they have a loved one, they want them to move in. I work at the Cadence Senior Living, and I work at the Kosher of Belmont.
Assisted living is not covered by Medicare.
No.
Okay, what is?
So
They're,
so that's another topic, right?
Yeah,
But
but home health.
right.
So,
So
and hospice, so it's separate. It's separate. They
So-
can come to your house, or they can also go to an assisted living.
And with the hospice, they claim that you're statistically 6 months and then you're dead.
Not always.
That is,
Not always,
that
I
is
know.
the Medicare regulation.
I know, not always.
However, we've had,
Carter's-
patients
like
that
Jimmy
have
Carter.
graduated from
Yeah,
hospice.
Jimmy Carter.
Or have been in hospice for 2, 3 years.
Sorry.
Yeah, there's
Ito
a-
na po.
what I'd like
Thank
to
you
do
so
is
much.
to
Love
continue
you.
to end
Hanggang
this,
dito na lang po ako.
is I'd love
Please
to get,
subscribe
you
sa my
need to write it
channel.
down, or give me some
Please
other
like,
topics
share,
you'd like to hear,
and
because Nancy can
subscribe.
speak on anything.
And hit the
Is there
notification
other
bell
topics
I think
you'd like?
the
Para
Medicare
ma-update kayo sa
benefits
aking mga
and what
lalong-lalo
covers,
na
what's covered is.
very
Is there something of
educational
interest?
sa
There's
senior.
And there's a
Yes.
palliative care as well. So
Bye-bye.
talking about what's the difference